Morning everyone, and can I add my acknowledgement of the traditional owners of the land on which we meet this morning and pay my respect to elders past and present. Fellow board members, Mental Health Australia members and friends of mental health, it's an honour to welcome the Prime Minister of Australia, Malcolm Turnbull, to our 2017 Parliamentary Advocacy Day. On World Mental Health Day last year, as part of our Promise campaign, the Prime Minister pledged to always take time to ask, "Are you okay?" and be relentless in our efforts to address mental illness and prevent suicide and self-harm. Today, on such an incredibly busy day at Parliament House and on a day where we reflect on the events in London overnight, another terribly sad day, and we think about the trauma and loss that many people are going through, it is a tremendous honour that the Prime Minister has taken time out to spend with us, and it shows his commitment to this issue, which is built on the election commitments for substantial mental health reform and the priorities he announced following the election. Last week, members of the mental health sector, including Mental Health Australia, met with the Prime Minister and Minister Greg Hunt to continue our relentless efforts in addressing mental health reform. And today, once the Prime Minister has finished speaking, I'm going to present the Prime Minister with our pre-budget submission, which is less about money, Prime Minister, and more about substantive change. So it's a great honour to have you here with us, and on behalf of Mental Health Australia and all our members, again, can I thank you for taking time out of your busy week. Can I thank you for your commitment to mental health, and can I thank you for the support you have for people who are disadvantaged, living with a mental illness, and people who are vulnerable in our society. So ladies and gentlemen, can you join with me in thanking and welcoming the Prime Minister of Australia, Malcolm Turnbull.
Well, thank you very much, Jennifer. Frank Quinlan, parliamentary colleagues, representatives from all across the mental health sector. It's great to welcome you to Parliament House today. The sitting week is definitely the place to be if you want to raise awareness right across the political spectrum, and I know that you're going to find a very receptive audience here. Many members of Parliament have a heartfelt, personal, electoral, national interest in addressing the mental health of our nation. Mental illness, as you know, can affect any one of us, no matter where we come from, what sort of job we do, how old we are. Our reluctance in years past to talk openly about mental health issues has been a real barrier to destigmatising mental illness. But as a nation, we've started to talk about it and the devastating impact it has on so many people. And once we acknowledge the problem, the issue, then we're better able to address it. It's important to talk about experiences, both good and bad, including that there are people who have battled and won. The member for Barara, Julian Leeser, as you know, spoke eloquently about this in his maiden speech to Parliament. Julian's heartfelt tribute to his father, who took his own life, gave us a remarkable insight into what was a really deeply personal and private pain. And we're very grateful that Julian was so brave to share that story. We know from our families, our friends, our constituents, that mental illness can rob people of relationships, of experiences and employment. At its most cruel, it curtails a happy, productive and fulfilled life, and for too many, like Julian's father, life itself. Of course, I don't need to tell you this. You're working with and supporting people, their families and carers. As you continue your critically important work, governments must equally seek to ensure that when people do reach out for support, they receive the best care possible. Now, I'm proud that my government is changing the way we deliver services and support by putting people at the centre of care. And I was pleased to strengthen our reform commitment further with an additional $192 million mental health package in the recent election. We must have a system that supports the mental health of all Australians, no matter who they are, where they live, or what the nature or stage of their illness is. Our primary health networks are now at the heart of planning, commissioning, integrating mental health services at a regional level. These are significant reforms, and I acknowledge they'll take time, and for an issue as multifaceted and complex as mental health, very careful consideration. A number of you have told me that these are the right reforms, and I've been very encouraged by that. putting care and support at the local level. So we need to get this right. The scale and pace of change is, I recognise, large and comparatively fast. And I'm aware that there are challenges as the reforms are being rolled out. But we're committed to working with you, the sector, consumers and communities, listening, and if necessary, adapting to ensure we get it right. We cannot do this without you. We are a very agile government, and if you can help us improve programs or policies, we'll do so. We're committed to doing that. Now, as Prime Minister, I have obviously a lot of competing pressures on my time, and so the bulk of the time spent on mental health is spent by my ministers, in particular Greg Hunt, the Health Minister. I know he'll be with you later. But I just want to say to you that mental health is an absolute passion of mine. This has been an issue that I have devoted a considerable amount of my time and attention to. And I must say I've always been taken with my good friend Ian Hickey's way of expressing the shared interest in it when he talks about the mental wealth of nations, paraphrasing Adam Smith. We all have an enormous vested interest, not just in our own mental health and in the mental health of our friends and family, but in everybody else's too. It is we have a vested interest in ensuring that we are a mentally healthy nation. We build up the mental wealth of our nation. Now, it's important for me not just to speak to experts like Ian, but also to hear from people in the community about their real experiences. And I've visited a number of headspaces. I've met with staff and youth using the services, for example. In Western Australia, I met with the Peel community representatives from Andrew Hastie's electorate of Canning, including school captains from a school that had seen 3 of their students take their own life in a very short time. I've sat down with Indigenous families and the crisis team from the Kimberley, hearing their heartbreaking experiences, but also of the hope they have going forward. And I'm hoping that our suicide trial site, working with local Indigenous services, will make a real difference. And after hearing from Defence and veteran stakeholders at a round table, we acted quickly with a review which will be released soon. And we're putting a suicide trial site in Townsville with a focus on servicemen and women and ex-service personnel. And more recently, Greg Hunt and I have met with a number of people to hear how our election package and reforms were being rolled out. This meeting highlighted, many of you were there at the meeting in fact, this meeting highlighted that there are some challenges, but importantly proposed solutions. Greg Hunt will talk in more detail about this, but the one area which especially relates to me directly is the National Mental Health Commission. We're strengthening their role in overseeing the reforms, and they will report directly to the Health Minister and also report to me at least twice a year on how the reforms are going. So you can be assured that the Mental Health Commission will be communicating and reporting directly to the Minister for Health and to the Prime Minister. Now, it's my hope that the reforms will soon reveal an improvement in all the statistics related to mental health outcomes. We'll be listening to you to find out how the reforms are working in practice, and we've already made some changes after feedback from the sector. The digital mental health gateway is proceeding. We've also extended the consultations for the 5th National Mental Health Plan so we can take account of feedback before it's finalised. On this National Advocacy Day, let's talk together about the gaps you've identified between the state-based acute mental health care system and the federally funded primary mental health care system, and around the integration of new services. And let's continue to discuss mental health not just from a health perspective, but from a cross-portfolio one, because a collaborative approach yields the results we seek. So we greatly value your insights and experience. So be encouraged by the influence you have here in this Parliament and around the nation, and by the enormous opportunity we all have to shape and assure the future of mental health care in Australia. Thank you for persistently aiming for a mental health system that works for the well-being of every Australian who needs support. Your work is important not only to them, but their families, friends, colleagues at work, and to the nation as a whole. We all have a vested interest in the mental wealth of our nation, in the mental wealth of every Australian. And thank you so much for continuing to advise us and guide us, and I wish you well as you speak to my colleagues and other members of Parliament and other decision makers in the public service, policy makers today. Thank you so much for what you do. We're relying on you to help us make sure that we assure the mental health, the mental wealth of Australia. Thank you.